happy to introduce our speaker today, Catherine Walsh. She's a licensed mental health counselor, and I'll let her introduce herself some more, and who works with children, adults, couples, families, hopefully I'm not forgetting anyone, on a variety of different topics like anxiety, depression, PTSD, and whole other myriad of topics, and implements different techniques. Some of the ones we had chatted about were like mindfulness, CBT, motivational interviewing, I'm sure some others as well. And although this is like our conference, she's welcome to any questions, interactions. If you are on and you can't talk, but you could type in the chat, please feel free to do so. And we're going to be touching on a bunch of different topics like stress management, maybe something about parent conversations and collaboration, counselor burnout, and all that good stuff that we want to know more about. So thank you so much for being here with us today. We appreciate it. And I will pass it over to you if you want to introduce yourself a bit further.
Yes, hi. Yeah, my name's Catherine. I do go by Katie, and I just want to say thanks for having me. I'm going to try my best to kind of engage with right away any questions any of you may have. Some topics I was thinking to start with are burnout, some self-care, and managing ways to communicate the best that you can with parents, challenging parents. Some possible delegation. I have experience in all areas, as Sarah explained. So there are lots of topics to cover. If any, I don't know if any of you guys have some questions off the top that I can kind of start with or lean towards, and then we can just go from there as it comes up. Like I said, any questions about or concerns about burnout or like the parents. One thing that I heard Sarah say was your initial statement at the beginning of the year, and already prompted right away, was getting back into this in some sense of normalcy. What I would say to that is, well, what areas don't feel normal or lack in improvement? And that's probably one of the first things, as a professional, that I kind of, catches my attention right away, is like, okay, yes, these are the positives, these are working in my favor. However, there are still these things, and we're left in the unknown. We're not really sure what to do. And those are the kind of approaches that I usually take with all my clients and people I speak with, to kind of go towards that direction and see how we can better that. So I don't know if anyone wants to bring anything up or where you want to start. Yeah, Christine.
What doesn't feel normal, and I hope it's not just my school, but I think in terms of giving the kids too much leeway, because we are understanding that they've been through so much and they've been through a pandemic. And of course, nobody knows what it's like to be through a pandemic. Nobody knows what that's like who's still alive. We've given them so much leeway that we've lost the discipline. So, I mean, I have some students who have been late an astronomical amount of times and absent. And to that end, there has been very little consequences. And so now what we used to do has been turned completely on its head. And, with detention, I don't even think there is detention anymore, or I guess we're getting back to the discipline. But I think this year we've completely lost it, because last year we were hybrid and remote. And so we had about 30% of the school remote, and the rest of them come in one week and stay home the next week. And it was a complete disaster. So this year was like, well, they've been through a lot, let's guide them in. And then it was just like, well, let's really guide them in and be soft. And I appreciate that, but I feel like it's gone to the other side of being too soft, and they're just out of control and doing whatever they want. And their parents are like, well, my kid's gonna come in at 10:30 today. That's it. And that's been,
So
not
I-
everybody, but
I guess one of the first things that I would address when it comes to that, in my mind, hearing your concerns and your comment, there's a few things. One was the students having too much leeway, losing somewhat of discipline on your guys' end. And then establishing rules based on hearing what parents are like telling you, not even asking.
mhm,
And so the first thing that I would say is kind of like the same approach that I had mentioned towards improvement. Okay, so like you've made some, but not all. So where do you want to start? Well, if you're saying maybe attendance is one of them, and they're having too much leeway, again, remind yourselves, first and foremost, this is almost kind of going in this year after the pandemic is trial and error,
mhm.
and learning how to step back into what's the new norm, giving yourself some credit and not being too hard on yourself to understand, like, okay, it went from all this remote, then hybrid, now this. So giving yourself that leeway to recognize, like, I understand there's going to be this kind of trial and error this year, but and this is the end of the year, so that doesn't mean that you have to go in the next year expecting what happened this past year. So you're working with some of accepting first, like, okay, there's some failures on our part, but you got to work with those in order to move forward. One of them was like the discipline for actions. I would say, as staff, the first thing that I would say is, okay, we recognize this, but what was it before the pandemic? And say, well, that's standard. Going into it next year, it's like, we need to reestablish those rules and all work together as a team to kind of stick to those. And regardless, the parents are a separate issue, but kids they may not know it, they need, crave, and want structure and routine.
Mhm.
That's where our jobs, that's where we come in to play that like role model or example of saying to the students, at least first, this is what it is. If you choose to do the opposite, there will be a consequence. And going into the new year is letting that be known right away. And so this year it was hard to kind of establish that because things were up and down all the time. I would say going in this coming year in September, work as a team to say, all right, we're not going to allow this anymore if admin allows you to go about that way, because it didn't work. This was one of the things that didn't work. All these things did, keep those. This is what didn't. So, we kind of need to break that down and make this better, this approach better. And so at the beginning of the year and next academic school year, one approach that you guys could take immediately to do your best to prevent this from happening is create some sort of like template or form or like some type of letter to the parents day one, revisit it during parent teacher conference in the fall, revisit it again and again and again as much as you need to. And therefore it can also hopefully help eliminate those parents that are coming to you saying everything's been great, at the end of the year they're just like, well, you never told me. And so you guys can back yourselves up by saying, we sent this out multiple times. And so you're delegating that, which gives you more free time to focus on other things that you need to focus on, rather than constantly, I guess that's the word I'm looking at, like chasing after parents. Oh, well, your child didn't do this, or your child didn't do that, or your child, like, so on and so forth. If you have templates already to say, just a generalized type of a letter, a form, or whatever it needs to be, a general one, and you can pull it up and you can change it accordingly or according to their status, their grades, their attendance, any other issues that, you're thinking of, send it out right away. Get it out of the way. Give the time to yourself that you need to for something else, a more important topic or another important issue. And then in terms of going back again, Christine, you said like use the word too much leeway. That could mean a lot of different things. So the first thing that I would ask is what does that mean?
I mean, I am a softie in terms of leeway, in terms of when kids come to me and if they're stressed out, I will let them sit there. But after a while, if they're late to school, 50 times, and it's not the norm. Don't misunderstand me, but I feel like there has to be some sort of a consequence if you're late. Maybe that's a pet peeve of mine, but if you're late and absent, and it is a pet peeve, maybe that I'm showing my little pet peeve, but if you're late and absent that many times, we're not preparing them for not only college, but life. If I'm late or absent to work a number of times, I'm going to get fired. And it's not preparing them for college. There needs to be a it can't just be, well, somebody's calling for me, so there's an extreme, there would be an extreme example of somebody having a mental health crisis or somebody who's hospitalized. That does happen. But I'm talking about kids who just decide I'm going to come in late because there's no consequence. That I've noticed, and I think it's just sometimes it just gets out of hand, and I feel like it's gotten out of hand post pandemic.
Mm-hmm.
So.
And what would I don't know if this is out of your hands or out of your control, but what does upper admin say about the absences?
I think this year, because this year has been so stressful and difficult, I think it's just gone out of our control this year. And I just think because it's gone out of our control, I think that's a September problem. And that's something that we have to handle in September. But I would say that this year was probably worse in terms of stress than last year, because I feel like last year half the kids were in the building. But last year was worse because if you try to get them on Zoom and they don't show up,
Mm-hmm.
So I mean, this year has been harder to be a counselor in different ways. Last year was harder to be a counselor because it's like nobody just shows up. And this year has been harder because when they're there and they show up, they're still not, they're physically present, but not emotionally present. It's been hard.
One question is, everyone that's on this call, is everybody also a counselor, a guidance counselor?
Yeah, I mean, looking at the names. Yeah, I think.
Yeah, everyone's a high school Catholic school counselor.
Yes.
Yeah.
I guess one of my questions regarding the absence, is it your job to manage that?
No, but I mean, I'll just speak really quick, and I won't want to speak too much, but if I'm looking for a student in the morning, I try to look for them in homeroom. They're not there. I can't get them. And I usually try to get them in homeroom and legitimately not there. And then I have to find them throughout the day. I'm just going to speak for me. So trust me, there's a million different things. I don't want to go into that, yeah. But they're literally not there.
It kind of varies by school too. Like we don't take like we're not in charge of the attendance list, but we are in charge of like attendance concerns. So if someone's out mm-hmm. or late a certain amount of times, then it comes to us, but we don't necessarily do the attendance.
And who at the end of the day, the final say, like who has the authority to pass fail for the attendance record? I guess that's what I'm asking.
Admin, yeah.
Okay, so I would say, like in terms of the absence, I'm validating like what you're doing is all you can do. So if you continue to keep that as an approach, as to saying like, well, I did my job. It was my job to check in. They weren't there. Yes, no, no, check. Check in again. Are they here? Yes or no? No. End of the day, yes or no? No. It's frustrating to know that, but what you have to keep in mind is like, you don't have control over that. And where the frustration, the stress, the burnout, the feeling overwhelmed, why that increases is because you're then putting your personal feelings into saying like, I can change this, I can help this, I can do this, I can do that. You can't. The student and the parent, they're the only ones that can. You're there to guide them and support them when they come to you and ask for it. That's your job. So keep in mind, like, there are going to be students that come into your office. That's amazing. The fact, even if they don't talk, the fact that they're sitting there means that they're aware that there's somebody out there to support and help them as much as they want it or need it. So your job is to, kind of focus on those students that are showing up, that do care. Because there's nothing that you can do aside from what you've already done is to check this off. Unfortunately, it's upper management's issue to say they didn't show up. The guidance counselor confirmed that, and that's all we have to go off of. If the parent then comes to you, maybe for next year, and says, well, this, or, I'm so upset, you should have passed my child. Start learning to delegate. It's not your problem. I understand, you can say that, speak to the parent. I understand, it's definitely frustrating. If you would like to address this further, delegate, give them the name or whatever, if that's appropriate in your school. I don't know if that's appropriate. It should be, because it isn't your issue to deal with, but I don't know if this is like lecturing you, Sarah, but but that's what I would say for that. And then in terms of, I'm using your words as well, Christine, because you said, if a student comes to me stressed out, maybe maybe I'm too lenient and let them sit there and just kind of calm themselves down and so on and so forth. You're choosing to use words for them, and I don't know if that would be their choice of words. So it's always important to keep that in the back of your mind too. A student comes to you, and if you're assuming they're anxious or depressed or stressed out, you're already putting that in your head and your approach to take. So now you're stressed out. So if you look at a student and they're just sitting there, and in your mind, you're like, well, they look anxious. Well, are they, or is that your assumption because that's how you feel when you get anxious? So it's like projecting. So something important to keep in mind is they're there because whatever they're feeling is sending them there because they know that they can get support. That's enough. If you say, do you want to talk? Is there any way I can help? Like, is there something I can do? A lot of times they'll be like, no, let them process. Maybe they just need the time to think things through, and they'll figure it out on their own. But one thing I would definitely highly recommend is like, don't jump in and try to fix things for them. They're, they know to come there first and foremost. If you just say, is there anything I can do to help? Do you want to talk? If they say no, say, I'm here if you need me. Continue doing your work. Know that they are there because they know it's a safe space. You can document it. You could write it down for the parents later. I don't know, like, your procedure. I would say to do that, just so you can kind of look for patterns, because you never know, like maybe they're skipping a class. That could be a thing. And so you don't want to just assume that they're stressed out, because maybe they're, they're establishing bad habits. Oh, well, Christine's really sensitive and lets me do whatever. So I'm just gonna go sit in her office during this teacher's class because I don't like it. So you got to keep that in mind too, and see if you're getting anywhere. So if you're documenting this stuff, you can create, you can look at a pattern, and then you start to realize, maybe we should try and talk about like this period during today instead of day one.
Now I'm like trying to go over in my mind, do I ask? I mean, I know I do ask what's going on. I know I do, but I'm wondering if sometimes I do ask, are you stressed out? I don't know. I mean, maybe I probably do sometimes. I mean, I definitely have done that once or twice. That's interesting. It's an interesting approach that I probably know, but don't know until like you put it in my brain.
And then, another thing to think about as well is, because you mentioned like anxious, the suicidal, those topics, right?
Right.
So that's our specialty. And before I go on, I need to say this too. Like, I want to be able to recognize all of you guys and appreciate every one of you, each and every one of you, for like the hard work that you guys are definitely in the trenches. Like you're the front line, whether you believe it or not. So you're getting on top of what you do. You're also, because of the pandemic, getting a lot of things like that's our job. But because we're high in demand, there's wait lists everywhere. So it's really challenging. And I just want to like let you know, like I think you guys are all doing a great job. Keep up the good work. I know it's super stressful. It will get better. As we said, like you even saw some improvements this year. So that's also hope for next year. But going back to those types of, I guess, even the words, that's not what you guys went to school for. So, and also social media. Everybody has ADHD, or everybody has anxiety, or everybody has depression. So if a student is coming into your office and they say, well, I'm just feeling super anxious, or I have like social anxiety, it's not your job to confirm that or to even kind of break it down. So remind yourselves of that. And that also alleviates any stressors that you feel like you might have to confirm or validate. My suggestion to kind of, I guess, go in or handle those is ask the students, oh, that's interesting. Like what made you think that, or like, what's your definition of anxiety? Put it back on them. Because I guarantee you half the time it's not that, but they're just calling it that because so is the rest of the student body. And so is social media. So that's something interesting too. So put it back on them, ask them what their definition of it is, and then pull up one of your generic templates and cross out one word and write, dear mom or dad, your son or daughter is stating that they have anxiety. And then if you guys have a list of referrals, you can say, maybe you should look into this or ask your pediatrician. I just wanted to let you know. Okay, done. Like, that's not my job, but I did the job that I was supposed to do, is addressing the parent. So now it's on them, not on you. And I would say keep sending those if they keep saying it, excuse me.
Right.
I wasn't sure if you were going to say something, Sarah, earlier.
Oh no, what we see with that a lot, well, at least in my own experiences, the parents are very hesitant and not open to receiving conversations like that usually, which has definitely been a struggle. Like in my own experience, because then we have students who are having all those feelings and it is all happening and being talked about during the school day because they're not allowed to, or their parent won't, which I know there's a lot more that goes into it. Sometimes they genuinely are trying and can't find it, but then there's some parents who kind of shut it down and are like, we don't want them to talk to anyone outside of school. Like, that's what you're for. Like, this is what we're doing. They can keep talking to you, but we won't find them outside support, which definitely makes it tough because it's kind of like that continued cycle. Like they keep, unfortunately, feeling that way.
And I think when that does happen, or if that ever happens as well, is it's still okay to put that back on the student and have them explain, say like, what do you mean anxiety? Like you said you were feeling anxious. Well, what does that mean? Can you give examples? Having them, it's so much more powerful than you guys may even understand, just to have them, vent or communicate, and you just there listening. That's it. It's not your job to fix or to give advice on those topics, because that is for a therapist. But to just say, I'm listening, I'm here, I appreciate you spending your time to tell me all these things. If it increases or gets worse, or the symptoms are around any severe, suicidal is a big one. I know that for sure. I don't know, what's your kind of policy or approach when you have students in that situation, or if you've ever had them in that situation when it comes to suicide?
So, hi, can I jump in?
Absolutely.
Cecilia.
Hi, I'm Cecilia. So Christine lives in a perpetual state of stress. So talking about stress to Christine is like, preaching to the choir. But I love what you're saying, Catherine. You're so on target, and it's such a good message for us to hear. But just to pick up on Sarah's point, I always want to throw it back at them and put the burden on them to, speak for themselves. But we were just talking about this at our school. We had a recent situation where the mom is against any outside therapy, but this freshman who's, 14, she's cutting herself, and the mom won't address that. Does anybody think that we go to the next level and report that to ACS as neglect? If the young teenager is in danger of hurting herself, does that become a mandated reporter's case? That's what we're struggling to figure out.
And in my field, any self-harm, harm to yourself or harm to others.
Yes.
Sorry, but I have to break
Report that.
confidentiality. And I let them know that right away. That's another thing you can go into the next year by stating that if you do need to obtain the, I guess, any rules or stipulations, if you're struggling with that through CPS, ACS, through the admin. But I think it would be justifiable, considering like this year itself has been the highest I've ever seen. And you're doing it out of care. Also, it's not your job to have to deal with that. And I'm sorry, like if the parent wants to refuse outside help, for whatever reason, I've seen that a lot culturally as well. But at least now you can let the parent know to say, well, I do have to report this. They're going to know, because you're setting the stage moving forward. Day one, I let you know, you were informed. So if it's not my fault, it's not my problem if you didn't read your email. I sent it. It was there. I did my job, and my job states, and according to admin, or you can talk that through with admin, that should be addressed. And that should be something that somebody is called upon, for if you guys are all mandated reporters. So if you need to look further into that, it's like, well, harm to self or others, that is harm to self in my book, my mind. And I let them know that day one when they talk to me as well. So that would mean, okay, I have to break confidentiality and I need to report it and contact somebody, whether, it's going to the emergency room, having them in your office and calling EMTs. The parents, like I'm sorry if you're upset, but that's my job. And I told that to you. So that's as far as you guys can take it in my mind. I don't know if anyone has any follow-up questions on that.
Catherine, would you consider putting that in a handbook?
100%.
So that
Again,
you can refer to it when it gets questioned or debated, or, somebody files a grievance against you?
100%. And that's why I kind of mentioned, I don't know if admin has to have a part in this, but you guys all have, it's completely backed up with facts and proof that this heightened year of teen suicide, it's not even just your school. So how, like, if you had to say that to admin, it's like, well, how can you say no? Like, this is the new pandemic, unfortunately. How can you possibly say no to that?
Yeah.
I don't know who else would be able to advocate on that, on your guys' behalf for that, but I definitely would. Absolutely, Cecilia.
Yeah, good to hear. I am admin now.
Oh,
And so I appreciate how, you're trashing us, but I love it because we need to hear it. So keep going. Don't let me inhibit you. I'm totally devoted to counseling. For 30 years, that was my life. And I love to keep my foot in it.
and in terms of the other things that, that I was suggesting, as in, for the counselors, it's like, you've done what you had to do. It's not your job. Then therefore reach out to admin. Do you also think those are some good approaches as well for everyone?
Yes.
And especially that's what I would do moving forward, going into the new year, so that it kind of alleviates your stress, so that you the rest of you guys can do what you're there to do and reduce how much, I guess, kind of like as Christine said, stress.
Cecilia knows me very well.
Right.
Oh, you, Christine, is to love you.
And it's a lot of added work. And so that being said, that leads into the next thing of burnout. Well, that's because you're doing 2, sometimes 3 people's jobs, one of them being a professional. Like, of course, you're going to be stressed out and emotionally overwhelmed, because when you think about your students and something like this happens, like self-harm, and the parent doesn't care, if you're like Christine, then you probably are taking that home with you, and now you can't sleep and wondering this, wondering that, and so on and so forth. So going into the new year, if you can set yourself up for success through coming up with general templates that you guys can all think, kind of mastermind together, and then having admin supporting you, then that alleviates a lot of it, because you've done what you needed to do. And therefore it's like, okay, I can finish my day and then I can return home. And then if there's personal stuff, you can address that without having that, that kind of chit chat in the back of your mind that you were working through during the school day. So if you're having that this year, and then you can't address your own personal life issues, that work-life balance.
Yeah.
And then what happens? It's just like, forget it. Like, well, I can't do this. I quit. And I've seen that happen too. It's just like, you just can't handle it. It's because you're taking all of this stress that isn't truly yours anyway. It's just you guys were dumped with it, and it's adding it to what you went to school for. You're not even able to put that into play. Like, that's your true passion. But guess what? Now half of it's taken away, and you're now given something else that you never specialized in. So you're like, I don't know what to do. That now you're saying like, hi, anxiety here. Can I come in?
Yeah.
Because you're unsure, which makes sense.
Yeah.
Another thing that you should be supporting each other with is validating that. Well, Cecilia, I didn't know what to do. It's like, neither did I. It's like, oh, thank God, I'm not the only one.
Mm-hmm.
It's important to relate to each other, to normalize these. Like, yeah, that's what I would have done too. It's because it's not your job. It's like, oh, okay. You try not to hold on to it all by yourselves.
Yes.
That won't help either.
I think for the counselors, that has to be an art almost, because when you say, oh, that's not my job, then you come across as uncaring. You're not good at what you do. You don't know what to do. It could come across as dismissive. So there's an art to doing that without making yourself look as cold or uncaring or unprofessional. But I certainly agree it should be done.
And I think also to add to that as well, is it does take practice, but if you're willing to take these ideas into consideration, it reduces that, because you're already setting yourself up for success with these prevention plans at day one.
Mhm.
So it's not that you're saying you don't care, you're saying I care enough to create all these and send them out constantly to show you that I'm still here. Now it's on you to recognize that. And if you choose to, I'm still here. Because I do care. But it's not to jump in and fix, because that's where you get overwhelmed.
Yes.
And you end up being stressed out. You're like, well, I care this much, so I'm gonna do this. It's like, you don't know if that student even wanted you to do that. That's where the confusion comes in, and that's what's not your job. That's my job, to help them understand that. So you wouldn't have known anyway. And that's where the validation comes into saying, like, to each other, it's okay. Like, that's not our job. Remember, we've done everything we can, and we're still here for when they come to us.
Yeah.
Because we do care. Remember that. Support each other. Say that to each other as many times as you need to throughout the day. You have to remind yourself to reduce anxiety, to control what you can and delegate what you can't. And even when you're delegating what you can't, it's still caring, because that was the right approach to take. Avoiding and ignoring, okay, well, maybe you need to find a new profession. So, but you need to work, like, like Celia was saying, I get it that it's hard because you want to try to do everything, but holding yourselves accountable and understanding that you can't, that's where the practice comes in. In order to do that, to continue practicing that, the best way is kind of setting yourself up for success by knowing, going in the new year, I'm going to plan to do this. That's how I'm going to care from day one, not, mid-semester, and then like understanding, like, well, I should have done this day one. So now at the end of this year, know that for going into the new year. And I definitely agree, Celia. I think it's great that you're hearing to put it in a handbook, because that'll set you up for success too. So they can't come back at you saying, well, it was here day one. And every guidance counselor followed up with you with this list of referrals, or with these ideas, or what their thoughts were, or on their absences. So it kind of works in for both of you guys, depending on departments. I don't know if anyone has any thoughts or comments or questions on what I've said so far.
I think delegation is important. I mean, I've been working on that because I was burned. I probably, if I took a burnout test, and I go to a conference every year, and I always go to the burnout section in a session, and it's always high. I've been trying to train myself. I used to answer phone calls immediately. I used to call them back immediately. And I've been training parents. I answer my phone calls, or I make my phone call returns at 2:00 now, because I don't want people thinking I'm readily available.
Mm-hmm.
Like if they call me at 9, unless it's like I'll listen to the message, and I realize if they leave me a message, can you call me back? I'll do it at 2:00, because people think I'm available immediately. And I've had to train people, because they're like, why aren't you calling me back like immediately? And it's how I said, okay, 2:00, I make a note, I will call you back at 2:00, the end of the day. And it's just helped me calm myself, because I would call people back immediately, and then they started to get trained that I'm available right away. And
Right.
it's actually given me a sense of of calming that, okay, it's after I eat my lunch, it's after I get most of my stuff done, and that's my little me time to just listen to my messages and then call people back, because I was going crazy.
And that's
So-
all self-care too, is learning yourself, learning your limits. So one thing as well, when you get really good at understanding yourself and recognizing what you're capable of and what you're not, is you could even go as far, like using your example, as next year, as a guidance counselor, say, okay, the best time to reach me is between, 12 and 3. So they already know that. Oh, if you
Yeah.
don't call back, if you don't respond, if they don't answer, well, that's because she already told me this is the best time. Give yourself, give or take, or leeway, or
Right.
if emergency. If an emergency arises, then within 24 hours, but you're letting them know basically to leave you alone
In the morning,
in the mornings.
the
Exactly.
busiest time.
Exactly. And it's like anyone can use that approach as well. That's understanding yourself and what you're, like what your bandwidth, what you're capable of doing and applying. Otherwise, like you said, when you were saying like, oh, I'm training, it's like, well, we call that you're enabling your parents. They, like you teach them, just like we do with students, that they can skip your class because you never discipline. So you're enabling that behavior by just, like not setting a boundary. They know that. Kids do it all the time. That's how they learn to manipulate their parents too. So it's, as long as you set that boundary, that limit day one, and stick to it as well. You have to discipline yourself almost
True.
to say like, no, I already said this. So like, no, I'm not going to get into that habit again. Oh, it's just one time. No, it isn't. Use that time to, do something for yourself. Be like, well, I'm not really busy for 5 minutes, maybe 3 minutes. Fine. Listen to a song you like. It's your time now. Feel good. Give yourself a compliment. Oh, I'm so proud of myself that I got done 3 minutes early. 3 minutes early? That's something. That's not overtime. That's not like you're way behind. It's just like, I'm so proud of myself for even like 1 minute early. It doesn't matter how small. You need to remind yourselves to be proud. Wake up in the morning, you made your bed. Oh, that's amazing. Good start. Now, when I get home, you're going to remember that you said that, and then be like, yes, I knew I was so proud of myself, and it's made. Little tiny things like that. You can teach your students that. You can teach your students that they're also in control of not failing from day one. Well, it's your decision. Well, I don't know what to do. I don't know what to do. What do you think that you should do? Put it on them. Like Sue was saying, what do you think that you should do? I don't know. Why don't you take a minute to think about it?
I like to say to them on the high school level, now you've been in school for 10 years now. You sort of know what works and what doesn't work in school, what kind of behaviors the teacher's looking for, what kind of grades you'd like to achieve. So what do you do to get there? And you put the burden on the student to come up with the ideas and the strategy.
And the whole approach to that, as well, Cecilia, from a professional standpoint, when you do that, it forces them to like come up with that answer on their own. They have to figure out, almost problem solve and think back, instead of you saying, well, you already knew and you didn't do this and you didn't do that. It's like, okay, well, you just gave them an answer. Even if they're doing something negative, it's like, well, why do you think you did that? I don't know. We all know teens say that. I don't know.
And then I always say, well, that's troublesome, because if you don't know, then you can't fix it. So you're stuck.
Right. And even saying that, concluding like you're stuck, well, then you're never going to pass, or then, okay, well, then I guess that's where we're at. Instead, it's just like, well, why don't you think about it for a minute? And don't be like in, interrogation mode, like staring, okay, I'm waiting.
No.
Instead, just go back and write an email. Are you ready yet? Like, did you figure it out? So you can even go one step further of like, well, just, take no pressure, take a minute to think about that, and I'll be here when you're ready. If you need help, like, let me know. But it's like alleviating the amount of stress that you are putting on yourselves after this pandemic has been insane.
Mhm.
So, I mean, like, and especially from teachers that I do work with, students and parents. So lastly, the topic of parents. We touched a little bit on some of it, how to approach it. What have you dealt with, if anyone can give an example that was like extreme, and left you shaken or unsure or worried for next year, if you can, or if anyone has any.
I mean, I have a parent that I've known for a number of years. Her son graduated in 2020 and her daughter's a junior. Her daughter has, I mean, I think she actually has a 504. So I'm actually going to diagnose her with like generalized anxiety.
Mhm.
But I'm 99% sure, I'm trying to remember. But I had to help proctor the AP exam. So I couldn't answer her phone call. It took me about 12 hours because I had to do it the next day or something like that. And she says, well, thank you for calling me back. And I said, well, I just got your message. And she says, and I said something to that effect. And she says, well, you're calling me now. So of course you just got my message. And she was just so nasty to me. And she was worried about the Regents exams because, the Regents exams are a mess. And she says, well, if she gets a bad grade, is it going to be on her transcript? And I said, of course it is. Well, she says, so I'm keeping her home that day. She was just bizarrely nasty to me. We've had so many nice conversations when the pandemic, I actually spoke to her. I remember working from home, speaking to her on my cell phone. It was so nice. And then suddenly she just changed and she's very demanding. She basically doesn't, if she gets a bad grade, she doesn't want me to put it on the transcript. Like, I can't do that. So I'm actually, and I'm never shaken when a parent talks to me, but I'm just so shocked that it's like a 180. So I just said, okay. And she talks to me like I work for her. And I'm just really surprised by that. And it's just, so I'm thinking, oh my God, I'm so stressed about this Regents exam. And every time she gets on the phone with me, it's just, well, thank you for calling me back. And I'm like, hello, how are you? And when somebody's nasty to me, I always take it down to that's very nice to talk to you, because I'm just not going to go to that level when you're nasty to me. So
another thing to keep in mind too is when you have parents that respond this way, out of the blue or even on a general, it takes practice again as well. But we have no idea what they're going through right now either.
Right.
So it's important to remind ourselves that, okay, she's snapping because who knows why, but this doesn't make sense.
No, it doesn't.
Never done it before. And so therefore it's possible, like, don't assume, but it's possible that she's going through something else and doesn't have anyone else to kind of vent to or let it out of her own head. So she's snapping at you because something didn't go her way, and that validates her own anger or frustration for whatever is causing that anger and frustration in her personal life.
Mhm.
And then in terms of applying it to the actual situation, if she's saying, oh, well, thank you for calling me back, of course, anytime.
Yeah, I mean, I just bring it down.
But instead of saying, like you had mentioned, yeah, well, I had something else or I was busy or whatever, you don't have to justify.
Okay.
So that also, like, that's wasting energy when you're trying to like validate another angry parent's response to let them know, to being like, well, I would never, it's like,
Yeah.
I don't care. So it's
Never justifying is so important, and it's such a natural thing. We
Yep.
want to defend ourselves.
I was just so
don't wanna be
shocked.
the bad guy. But yes, and Christine, I totally agree. You got to bring it down by your own tone.
I did, yeah.
And I often say, you sound so angry or you sound stressed out. You want to, what's up? And that takes them off guard because they don't expect you to call them on it. And you're not calling them on it to correct them, but out of concern for them. You sound really upset. Tell me what's going on. Trying to get more out of them.
Yes, and that I would say like, yes, that can work depending on how well you know your parents, but it has the potential to backfire as well. I'm not angry. Why would you say that? And then now all of a sudden they're defensive. So that has the potential to happen as well. I've seen that happen with me. So, you can go there if you know the parents that you're speaking to, if they would be, willing to hear that feedback or not. But yeah, so not justifying yourself, like Cecilia was saying, that takes practice because you don't owe them that at all, so very much so stick to the issues at hand.
Yes.
So if there's an issue with attendance, again, beginning of year, these were the this is what you saw, signed, whatever, or the emails went out multiple times throughout the year. You could remind them about the failing. Unfortunately, I'm sorry, I understand this is frustrating, hence Cecilia's comment about the emotion that they're projecting. I apologize. I know this is frustrating. I understand this may be upsetting.
Validating, basically.
And not saying like you sound that way, but basically like, just like I'm hearing some frustration and, it sounds a little upsetting and I understand that. But, this was mentioned at the beginning of the year. If you'd like to discuss further, here's Cecilia's email.
Bring it
Here's
on.
the email for our administrator.
I don't like this
For AP.
I don't like this speaker. But it could be helpful. In other words, like just again, delegating it, saying like you knew everything. So, and also keep in mind, if they decide to take it out on you through emotions, this is a really hard thing to practice too, but they're allowed.
Yeah.
You can't do anything to change that. So all you can do is focus on what can I do being in this situation. You can yell back too. You can try to justify yourself too if you want, but you can also say, all right, well, this person is frustrated, upset, angry, and I can't change that. So I'm just going to focus on what I can control. And that's the facts. And this is what's happening with the student. If you have to remove that student, that name from your head, just to kind of separate emotions, that sometimes helps as well. And you're just, keeping an idea in your head of just like, here's a parent and here's a student I've never met before. This is their reaction. So you don't associate that parent with the old version of the parent that they were so nice. And that's now you're expecting that every time.
Yeah.
So sometimes that can be a helpful approach as well. That happens in life. You're going to have people that don't like you or that lash out for no reason. It's not your job to figure out why. So you just focus right back on, I guess, the process, basically, because that was the process, right? Of like, well, they failed. So the process is we have to put that on
Sure,
their
yeah.
on the transcripts. Yeah.
Yeah.
If you want to look back at the handbook, Cecilia's in her office right now. I'm sure she'd be happy to show you that.
I don't work with Cecilia, but I wish I did sometime. No, she works in another school, but I've known her for a long time. Miss you.
Oh, nobody,
you in person.
not everybody on this call is from the same.
No, I know Cecilia. She's at Bishop Lachlan. I'm at St. John's Prep, but we all do know each other from
I see.
this organization.
I see. Anyone else have anything they want to add about any struggles? I do. Yeah.
This is Barbara. No, I just wanted to add that I do work with Cecilia. She
Don't
actually,
throw me under the bus.
As do I.
she has been known as the parent whisperer. Because parents walk into
Yes.
the
Oh,
office
that's good.
screaming.
She's
And they
she's
walk
really
out-
good at disarming people for sure.
They walk out hugging her and thanking her always. So she's amazing. And yes,
Wow.
Yahira and I'm sure you would agree, Yahira, we frequently refer them to.
Yes, we do. And there's nothing else that we can say or do to get them to calm down. Cecilia is definitely the right person to go to.
Yes, yes.
See, Christine, they're all delegating.
Oh, you know what? Then Cecilia's gonna be hired as a part-time contractor at my job.
Well, but see, I'll tell you the truth about that. If I didn't have 30 years in guidance,
Yep.
I wouldn't be as a good assistant principal as I can be.
Yeah,
Learning how to
it's practice.
communicate and how to speak non-defensively. That is a art that we learn as counselors. And that's, why I still feel I'm a member of the guidance department, because my skills that I use all day long, both with students and parents, are my guidance skills. That's what gets me through the success that I have in this new office. Well, 11-year-old office, but still feels new after 30 years in guidance, right? So,
I think that's amazing, Cecilia. I really appreciate your feedback as well, and for kind of just being open-minded to some of the suggestions. That shows that you still care in that sense as well, and not kind of just stuck in when you first started, be like, nope, this is how it is. It's always going to be that. It's like, well, things change. You got to learn how to change with them.
yes.
We are blessed, definitely, to have her in that role.
I agree.
I just wanted to mention one more thing, and then I can just kind of open it up if anyone else has any follow-up questions. But I just wanted to kind of, I'm curious how many of you guys allow, like if you have health class or something like that, if you allow topics or addressing during curriculum on mental health, or if you don't at all.
Well, we don't,
Okay.
but we should, I believe, because of how extreme things have gotten after coming back to school. I can't tell you how many students came to me today, because we're talking about final exams next week. They've never taken a final exam since COVID. So these kids have never taken a Regents exam, and they've never done a final exam. So they're all saying, can they opt out? Because that became a new vocab with, the public schools, of opting out of tests. And no, there's no opting out of the Regents. We're all taking it, and a final exam. But the grade doesn't count, does it? Oh, yes, it does count. It influences your. So it's a whole new re-education of things that we take for granted, having done it for years and upon years. And it's really new for the kids. So to stay patient with them, even though their questions sound a little inane, and maybe even Christine, just thinking about it, maybe that's why this mom is so nuts, because when the son was one thing, but now the daughter has not had to experience any of this stuff. And the parents are frightened and trying to protect the kid from consequences of a bad grade or whatever else.
Yeah,
You're right.
I was seeing that as well with my clients that have children. I'm seeing like a lot of, like just anger, anxiety, and them being upset, not knowing or trying to protect their child. That's exactly one thing that I was thinking of as well, Cecilia, because, the whole opting out or this or that during pandemic, everything was the parent not knowing anything and trying to either protect them, or if they had to become, they're working full time and now they're being, at home teachers, and they don't know how to do that. they're also getting like creating a bad habit of, well, how can I get my child out of this so I don't have to do it either? So I was seeing a lot of that as well. And that passes along to the student because they don't know any better. They're just following their parent as well.
Yes.
The reason why I asked that question, if you guys have that in your curriculum or bring that up in like health class or whatnot, is because recently I have a student, a young student, probably a middle school. And in that student's health class, I guess the teacher showed a clip on generalized anxiety disorder through YouTube. And my client, the young student, he couldn't even pronounce the word generalized and immediately was convinced that he had this disorder. And that was concerning for me to hear because I didn't know. Obviously, you said your school doesn't do that. I professionally, like my personal opinion is like, I think that's unacceptable. Because again, you guys are not licensed professionals, but now you're implementing this into their thoughts. And how it came up, because the child sent me the link, it came up in YouTube. So there was all these other suggestions, and you guys know where that goes.
Sure.
And so I let the parent know that that was a concern of mine, because regardless if a child has anxiety, depression, social anxiety and whatnot, that is for a professional to diagnose and even break down to the parent about their child, not to the child directly, and create even more concerns that the child may not even had in the first place. So that was concerning to me, and I didn't know if that was in your school or not. I
would never want that. That's a bad thing. That's
Yeah.
a dangerous thing. And it's above your pay grade, so to speak, to do anything like that. But to go into a health class just to ask the kids in the class as a way of having a group to say, how's everybody doing? And give
Correct.
them a, sort of like a little group therapy, just how's school going for you? What are some of the things you're facing? Normal concerns, and having a class setting to do it so that you're reaching as many kids as you can. It's really for like an economy of time to use a class, but certainly not to teach a lesson on something that is, you don't know who's in your class and how they're taking it.
Diagnoses, correct.
The client then becomes anxious because of what he heard in class, and that's never good.
And then in turn starts labeling themselves and feeling out of place and insecure, and that's unnecessary and uncalled for. In my professional opinion, I don't think that was right. But Cecilia, what you were saying, like, yes, like the groups are important to have, again, even as adults, to validate, normalize, saying, we're all nervous. Like, they don't have to use socially like anxious and words that a licensed professional therapist would use. They don't need to know those terms unless their parent chooses to include them in a session. But in the meantime, a lot of them, because they're so generalized on social media, I would kind of encourage you to minimize and use the thesaurus, like, oh, you mean like being nervous or worried or concerned for when you're anxious, or if you're sad or even frustrated or having a challenging time. It's not depression.
Yes.
This is not a diagnosis. Like a lot of these terms are getting thrown out there, confusing every student and child unnecessarily, in my opinion.
Yes.
I mean, I had that
Good
happen. I
observation.
don't know the curriculum. I mean, obviously I don't know the curriculum in the health class, but I know that happened to, I had a senior who came from another country and then didn't take a health class and needed to take it. It's supposed to be a sophomore class, and then was exposed to a lesson that had to do with depression, and then came to me and then talked about suicidal ideation. So then I had to refer out. And that became my whole day.
Right.
And I was just like, oh my God, I'm like, oh, wait a minute, that did happen. But so I don't know the specifics. I mean, they should be doing some sort of a general, not
Yep.
generalized anxiety, but a
Right,
general
right.
mental health
Yep.
overview with the students, because mental health is health. Just like it
Right.
would be like, you know, if you hurt your foot, you do rest, ice compression, you should go over that. But you should be doing some sort of general mental health piece, but I don't know if you should be doing specifics. It should be so general.
Or even
Yeah.
just saying, you know,
I don't know the
the
curriculum.
topic is about, you know, the general topic is about self-care.
Yeah, maybe, yeah. I don't know what they're teaching. I mean, the thing is, we
Well,
don't
they
know
do
what
teach
everybody.
mental health and health. but
Yeah,
that's
they
the place
should.
to do it, and they're teaching it as information, not as treatment,
Correct,
and
correct, absolutely
diagnosis. So
correct.
yes, it's appropriate to teach that from a health teacher, and it's for knowledge and information, but it is not to do therapy or to make a
No.
diagnosis.
No, oh
Yeah.
God, no. No.
Yeah, I just wanted to kind of hear feedback on your end. Cause this was this was new for me even to hear. And I thought it was highly inappropriate, personally. So I don't know.
YouTube clips, we've got to be careful of, because they can lead you down.
Well, also like when you open them and they send it to the student, it's like, oh, here's another suggestion, another suggestion.
Yeah.
You don't know where those suggestions are ultimately leading
Correct.
either.
Correct.
And if it comes from a counselor, then it does take on that more treatment or diagnosing. So that's what you don't
Mm.
want. Again, should go back to an academic way of approaching it. I want to talk all day with you guys. This is like the best thing. It feels so good.
It is great.
I hope someone or all of you at least took one thing from this and it was helpful.
Yes.
Definitely.
So I'm being paged, so I'm going, but I really am so grateful. Catherine, you're my new best friend. Love you. That was so good.
Anytime.
And,
I appreciate you having me here.
Yeah, I got to follow up and find out more. So
Absolutely.
Christine and Sarah, everybody, Yahira, Barbara, talk about having great guidance counselors. These 4 women right there on the screen just doesn't get any better. And I think
Chris
it's
is
so
here too.
blessed to be in Catholic schools, to be honest, because we can do this, we can share with each other, we
Yeah.
can know each other. And we're blessed where we work, because I think there is a lot of support. And we
Yeah.
created this back in 1983.
Wow.
So, you know, we're proud that we're still going, and generations of, you know, guidance counselors. All look at Sarah and Christine, they're BABYs. And here it's they're picking up the torch, you know, and I just feel so gratified when we meet like this.
Yeah,
And to
thank
have
you.
a professional from the outside, Catherine, is really very stimulating.
Absolutely. I'm glad I could help. And it'll be the future generation, Cecilia.
Yeah.
Look back and be like, well, how were they the, you know, the forefront and paved the way during a pandemic? Let's look back in our history books.
Yes.
It's true.
Great. That's great. Okay, so carry on and fill me in of what I missed, but thank you all. Have a good night, all.
All right, thank
Bye.
you. Nice
Thank
talking to
you.
you.
Thanks. Bye.
I think that's everything that I wanted to kind of go over for now, unless anyone has any other topics that they wanted to touch base on or ask me on. That was good to me.
Catherine, I just want to take a moment to thank you. I think that you've been super informative and very much relatable. It's clear that you understand everything that we go through on an everyday basis. And so I do appreciate the time that you've taken out to advise us and guide us on the ways in which we could best provide support. So thank you again.
Thanks, Yahira. I really appreciate you being here as well. And your work, everyone's.
Thank you, thank you.
so much.
And thank you, Christine and Sarah, for putting this together. We truly do appreciate you. It really is
Well, thank you
very
for-
beneficial
Thank
to
you.
me.
Yeah, thank you all for being
this
here. We
way.
appreciate it a lot.
This was
Yes,
awesome.
thank you.
Yeah, thank you. It's
And
really
we have
good.
it taped for the rest of our membership, so we'll figure that one
Get out
out.
there.
But yeah,
Yeah.
it was super informative and really helpful. And, you know, no matter how many years, I mean, I've been 17 years, and every year in September, I said, okay, I'm going to do something better and I'm going to do something different. And you've given me something better, multiple better things.